Hello, everybody. This is Charlie, and this is going to be the first of a series of brief videos. These are intended as either an addendum to DBT intensive training or a preparation for it, though they could be freestanding ways to get introduced to DBT skills. And I want to make clear what this is and what it isn't, because what this is not is a complete preparation for you to teach the skills. It's an introduction to the nature of the skills modules, and it opens them up to you. For some people who already know the skills, it might be also included some teaching tips coming from me, just from my own experience, my way of telling about the skills that might be helpful. And so please don't misuse this as if this is a freestanding replacement for the manual. The manuals are fabulous, maybe the best in existence on skills training of any kind, as far as I can tell. But there is the DBT Skills Training Manual for therapists. This is edition number 2 by Marsha Linehan. And there's an associated manual, which is really, handouts and worksheets, a spiral-bound volume that has all of the handouts and worksheets that go with the whole program. So in many cases, patients have bought the handouts and worksheets so that they have them all in one binder rather than handing them out one by one as you go through the teaching. But either way is acceptable. On the other hand, the therapist who teaches the skills should have the skills manual and use it as an overview at the beginning, because it tells you everything you need to know about setting up a group and what the guidelines are and what the assumptions are and what the agreements are, and et cetera, et cetera. And then it also tells you skill by skill how to teach them. So it's a fabulous manual. Please use it step by step. On the other hand, it can be helpful over a period of maybe 4, 5, 6 hours for you to get an overview of the skills in order to help you get started. And so that's what this is. All right. I've said something about using the manuals, and so trying to think if there's anything else. Let me say a few things. The second edition of this, which came a good 30 years after the first one, has within it almost all the skills of the first one, and then a lot of add-ons and revisions, not revisions of what the skill is, but how to teach them. So you really, if you already learned the first ones, you're in very good shape. And this manual just has an enormous number of possibilities. Let me tell you what that is and how to use this manual, because in the handouts and worksheets part, and these handouts and worksheets, by the way, can be downloaded from a website by anyone who buys the other skills manual, and it says early in the manual where that website is. So notice this, see the star up to the right. Every page of this manual that is considered a kind of a handout that Linehan would usually use, and that's part of the kind of core curriculum, you might say, of the manual, is going to have a star. That helps guide you through, because there are way more in this manual than you can possibly teach in one class. So first thing to tell you. And you want to set up your curriculum looking through a module in advance and figuring out, are you going to teach anything in addition to those core skills? And if you are, because there are supplementary skills in each module, there are skills that you can teach if it's a specialized group, or if it's an add-on, or it's just something that specially interests you. But many groups don't teach those skills until a certain specialty group comes along. So just know that you need to do a little extra prep in deciding almost listing week by week what skills am I going to teach, rather than just sort of going into it, because then you're going to find out you don't have nearly enough time to teach all the skills. Secondly, when you choose which skills you're teaching, then you'll see which handouts you're going to use. When you see which handouts you're going to use, there sometimes will be more than one handout, and they'll be listed like handout 2, and then handout 2A or handout 2B. And that gives you an option if you prefer one handout over another, or you think it'll work better for your clients, then you can do that. Once you've chosen your skills and your handouts, you then will be able, in the manual, it'll give you lots of teaching examples, teaching stories, teaching metaphors, so you can look at those in advance and figure out if those work best for you, or if you want to come up with your own. Finally, for each skill, there's a variety of possible homework assignments, practice assignments. And so for those, there's different assignments and different worksheets to go with those assignments. And sometimes there's more assignments than you need. And so you need to figure out which assignments am I going to use? Which do I think are suitable for my group the best? So there's some choices to be made between what skills, which handout per skill, which clinical or teaching examples am I going to use per skill, and which homework practice assignments and worksheets am I going to use. And once you've got all that lined up, you've got your package set, and then you can go forward. Okay? So I wanted to let you know that. Next, I don't want to go over and do a review or preview of all the different things about this manual. We'll pick that up as we go along. I mean, what'll be different or what's been added. I really think that's already written about in the actual skills manual at the beginning. If you want to read about what's the same and what's different about this, it's well written at the beginning. So you could look at that. But one of the things from the beginning now, and is that there's a kind of some general skills that are put in at the very beginning as a kind of a precursor to teaching the 4 modules of skills. And and there are handouts for those, and those are under a part that's called general skills. And the first part of that is orientation. So you're going to see a list of guidelines, which are kind of the rules for the group. A list of assumptions, which are assumptions you make when you teach this that help you stay on track of being both compassionate and effective as a teacher. It's going to include a kind of overview of what are the problems that bring somebody into a group like this, what are therefore the targets of the group, and what things do we want to reduce, and then how are we going to reduce them, or what are we going to replace them with. And so, for instance, mindlessness might be a problem, and you're going to replace it with mindfulness skills. So you'll see that and a handout about that. You could choose to use that or not, or use it however you want to introduce the overview of the skills to the patients, but it gives you an option. And finally, and a very helpful addition, I think, is teaching patients how to do what we've always taught therapists to do, which is to do behavioral chain analysis. It's teaching patients how to assess their own problem behavior by looking carefully at the step-by-step antecedents to that behavior, and then the step-by-step consequences following that behavior, and then trying to come up with alternatives or replacement behaviors along those steps that could lead to a better outcome in the future. And so there's worksheets set up for that, as well as instructions for how to do it. And it's so parallel to what we do as therapists that it's a nice thing to teach, and it'll help patients be better co-participants in their own therapy. They're doing their own assessment of their own behavior. Some patients find this incredibly useful, and so I highly recommend that. I'm not going to go over the teaching of that in any more detail now. Again, of course, that's taught well in the manual. All right, I'm going to get into the first module now of skills. So now you've begun teaching, and you usually start by teaching mindfulness skills for the first 2 sessions. There are several handouts for mindfulness skills, of course, and I think your ideal use of these videos, is going to be if you have in front of you the worksheets or the handouts. So either you have this package with you while I talk, and you go, because I'm going to reference different handouts. And those of you who come to my intensives, also there's PowerPoint slides that are keyed to the different handouts that you can be looking at while I talk. Okay, so we're going to now move past the general worksheets and to the mindfulness module. There is first, mindfulness handout number 1 is goals of mindfulness practice. So let me say something about that. There's 3 listed. One is to reduce suffering and increase happiness. And the idea there is that it is possible by the effective use of mindfulness to bring your attention, to strengthen your attention and bring your attention to pain, to misery, to emotions, to thoughts, or to bring your attention deliberately away from those things at the right moment, and to gain more control of your mind, not by controlling the contents of your mind, but by controlling your attention, so that you can move your attention in and out of different things going on inside you and around you. And that turns out all by itself to be a very powerful tool for tolerating suffering, for alleviating suffering, for transforming things. And these mindfulness skills are used throughout the manual in the other modules as well. So this is like the pure module of mindfulness skills where you get the basic building blocks of mindfulness. Second big goal, increasing control of your mind. And that's basically what I was just saying. It is a way of controlling your mind that's different than what some people think. Because a lot of people, especially people with a lot of emotional pain that feels out of control, tend to think that the way to get control of your mind is to get control of the flow of your mind, get control of the contents in your mind, to cut parts of your mind out, you might say, to block it out, to suppress it. In fact, those ways are very short-lived victories in controlling your mind, because the powers that be, the emotions that are there, reassert themselves with more force often and in ways that you don't see them coming. So that it's just, the idea of this is to control your mind by being aware of your mind, by shining a light on your mind, by having attention focused on things. And the third goal is experiencing reality as it is. And Linehan writes, to live with your eyes wide open. This is like whether something is coming at you that's good, that you want, something's coming at you that's bad, or it's going to be uncomfortable. It's being wide open. It isn't screening things out. It's making choices after seeing what reality is. And it's getting better at tolerating and accepting that certain things are reality, and then see what you want to do about them. It doesn't mean agreeing with them, but it does mean acknowledging what is real. Okay? And this includes that even when you feel cut off from everybody and from the universe, it's letting yourself experience that in a deeper way, you do have an essential connection with the universe. You have an essential connection with reality. There is a wisdom in you, and there's a goodness in you. And the idea is to be able to see that, as well as to see things for what they are, including really negative experiences. Okay? What? I'm sorry, my computer just screwed up and I wasn't aware I was still filming. So I'm going to stop here, and I'm going to be starting in another few minutes.